Namaste. I am Dr. Ananda Balayogi Bhavanani, Director of CITER, the Center for Yoga Therapy Education and Research in the Sri Balaji Vidyapith, Indian University in Pondicherry, South India. I am also Chairman of the International Center for Yoga Education and Research, popularly known as Ananda, the home of Ananda Yoga. I am pleased to meet all of you on this occasion, celebrating the Global Yoga Therapy Day this year for the first ever time on August 14th. Thanks to the work of Yoga Mate, we are all coming together, spreading the true spirit of yoga and yoga. Coming to the topic, today we are discussing about yoga and breathing disorders. Breathing disorders are something that are as old as humankind itself. And my father Swami Ananda used to often say, dyspnea or difficult labored breathing is as ancient a condition as the medical history of humankind itself. He used to say that the problems of breathing begin as early as the first breath of life for many a human being. This robs the individual of the health, wealth and happiness, and is often a major challenge to people working in healthcare. There is a beautiful illustration that depicts how forests are the lungs of the world. We can see in this beautiful depiction how the trees are giving us the oxygen, and we, in turn, are giving them the carbon dioxide. A beautiful symbiotic relationship that has been there for so many hundreds of thousands of years. Yet today, we are forgetting the importance of the trees. And as someone said, if just trees would give up Wi-Fi, we would be finding them everywhere. Too bad. They just give us oxygen. As a human being, we need to realize we, the microcosm, and the world and the universe, the macrocosm, are one and the same. As yoga therapists, we are often dealing with clients who have breathing disorders. The breathing disorders may be from childhood or suddenly occur in the adult stage. These chronic disorders are usually in the form of bronchial asthma or chronic obstructive pulmonary diseases such as bronchitis and emphysema. According to the WHO estimates, hundreds of millions suffer from these disorders and 235 million having asthma, 64 million having COPD, and millions having allergic rhinitis and other minor conditions. COPD is not just an irritating chronic cough, but is a major contributor to both morbidity and mortality, with the WHO predicting it to be, in 2030, the third leading cause of death worldwide. These conditions, bronchial asthma and chronic obstructive pulmonary diseases, the major symptom is usually a shortness of breath resulting from obstruction to the bronchial airflow and a chronic cough. Excessive mucus secretion is a predominant symptom in those with asthma and bronchitis. In bronchial asthma, there is narrowing of the bronchial airway, and the severity and wide variation in the obstruction leads to sudden onsets of panic. We can see in this illustration how the normal airway is contrasted with the asthmatic airway, where you can see how there is the tightening of the airway leading to the reduction in the lumen, and then on top of that, what happens is that the mucus plugs go and block it further. Air gets trapped inside, and this is why one of the very important SOS techniques of yoga useful in such patients of bronchial asthma is to learn the Vastrika, especially a Vastrika, a bellows breath based on Mukha Vastrika using the mouth. And here what we do is we take in a breath and then we blast out through the mouth. This type of forceful blasting, when the person can learn it, is very useful, because the moment you blast like this, what is happening is that you are relieving that air trapped inside those narrow passages. This is one of the very important SOS techniques that we need to keep in mind when working with people who have bronchial asthma. In the case of COPD, especially emphysema, what happens is that the air spaces beyond the terminal bronchiole, they become over-distended and the alveolar walls, they collapse. This leads to the classical pink puffer appearance, where the person seems very pink and they keep on puffing the way as they breathe. You can see in the illustration how the healthy alveoli are contrasted with the alveolar membranes that are broken down in emphysema. In chronic bronchitis, the mucous membrane lining the bronchial tubes, they become inflamed and swollen, secreting excess thick mucus, and this obstructs the passageway. So what we have is, whereas in bronchitis there is this excessive mucus, in bronchial asthma there is this excessive mucus, in emphysema the walls have broken down, and so there is less area for the gaseous exchange to happen. So the way we deal with it needs to be slightly different. When there is excessive mucus, according to the yoga assessment, it would be more of a kapha, and that kapha needs to be cleaned out by practices such as neti and dauti that we will describe later. The major focus of yoga therapy is health, wellness, and a wholesome feeling of well-being. This is the concept of salutogenesis. Salutary, the word for health, and genesis, the word signifying the factors that enable health to manifest. The modern tendency is to focus on pathogenesis, and we become limited in our focus on disease alone, thinking that we want to get rid of disease. We forget that as healthcare providers, we need to focus on health, that is salutogenesis, rather than disease, that is pathogenesis. This is an essential movement in yoga therapy, and the work of Antonovsky in salutogenesis is very vital. As you can see in this illustration, we don't have the stressor coming into our life, and when the stressor comes in, we are put under tension. There are the neurochemical peptides that then are released. There are the HPA axis, there is the sympathetic arousal, and all of that is brought into play. But depending on how we deal with that stressor, which is our choice, our response, we can either go on that salutogenic pathway towards positive health, or the pathogenic pathway, that is the breakdown. The choice between positive health and disease is basically within us. How we as an individual deal with the stressors in our life. Because as I often say, nothing can stress us if we don't let it stress us. The moment we allow it to stress us, the whole stress response, or rather the stress reaction, kicks in, and then all the psychic, psychosomatic, somatic, and organic phases of psychosomatic disorders start to manifest. Yoga has numerous tools, and the Ashtanga of Maharishi Patanjali, given to us about 3000 years ago, is one of the most valuable pathways, a blueprint for a healthy life. The World Health Organization talks about health being a state of physical, mental, social, and sometimes even spiritual well-being. Social well-being, well, the Ashtanga, the two components of Yama Niyama, help us to have that social health. We can say that the asanas and the pranayamas work on producing a physical sense of health at one level. We can say that pratyahara and dharana work on the mental health, and then we work on jnana and samadhi, spiritual health blossoms. So the Ashtanga can be understood as enabling us to be as healthy, as happy, and as wholesome as we can be in this life. The mechanisms of yoga, as depicted in this diagram, they include all aspects of human psychophysiological functioning getting improved. How does this happen? Well, the base of that pyramid is the integration of the breath pattern with coordinated smooth body movements. This, along with the conscious focus on the present moment, the now, enables the body to be stilled and the mind starts to calm down. When the breath is steady, the emotions become more balanced, and then all aspects of human psychophysiological functioning are improved. The key, as you can see from this diagram, is that the body movements and the breathing are to be synchronized and the mind focused in the now. This brings together three of the koshas. The Panchakosha model of yoga enables us to understand we have the Annamaya, the physical aspect, the structural existence. We have the Pranamaya, the energy, functional, physiological existence. And the Manomaya, which is our psychological, mental existence. All these three need to come together in harmony if we are to be healthy and happy. So, to bring these three together, bring the body and the mind together, the body and the mind are normally fighting a lot. It is often said that the body and the mind are like two people who hate each other to death, but having to live together in a single bedroom flat for the whole life. Imagine that is harmony. Imagine the duality, that Dvaitam that leads to a split between mind and body. If we want to bring the mind and body together, the facilitator is the breath. Body and the mind coming together with the breath, that is the key somatopsychic mechanism of yoga. A beautiful image given by my dear Dr. Satyar Khalsa, who is at Harvard Medical School, and for all of us in the field of yoga and yoga therapy, we know as one of the leading researchers in yoga. He has given a beautiful schematic that helps us to understand how the yoga practices, including the postures, breathing, relaxation and meditation, they can enhance our fitness, self-regulation, awareness and spirituality. This ultimately leading to an enhancement of the global human functionality. This is the best flowchart, to my knowledge, when it comes to understanding how the yoga practices bring about this wonderful sense of wholesome, healing, health, and happiness. Yoga places great importance on 5 components. These 5 components are the achara, healthy physical activities and exercise, which are the right thoughts and right attitudes towards life, ahara, a healthy, nourishing diet with adequate intake of fresh water, vihara, proper recreational activities, and vyavahara, healthy relationships for social health. Q&Co and colleagues in 2009 published a report in which they have given a beautiful flow diagram of the relationships between dyspnea, proposed benefits of yoga, and the participation in such a yoga program. The mechanisms and correlates of dyspnea include hyperinflation, hyperventilation, and hypoxemia. You can see how, though the person is breathing, because of air getting stuck inside the lungs, they are not getting enough and so are made to hyperventilate, and yet at the blood gas level, they are still having hypoxemia. There is a hypercapnia, more of carbon dioxide retaining, increasing the work of breathing, leading to respiratory muscle weakness, deconditioning, and of course, when the body is functioning at such a lower level, the mind gets influenced, and depression, anxiety, and fatigue always set in. On the other hand, they suggested that the proposed benefits of the yoga training would include a reduction in the respiratory rate, a decrease in the airway resistance, enhanced respiratory muscle strength, a decrease in autonomic arousal with decrease in heart rate and enhanced heart rate variability. This is vital in the health of someone suffering a breathing disorder, because the sympathetic tone, as it increases, the stress increases the sympathetic overactivity while reducing the parasympathetic. The parasympathetic is that part of the autonomic nervous system that enables us to heal ourselves. And this is why the role of yoga in balancing autonomic activity is so vital here. Reduction of the sympathetic, enhancement of the parasympathetic vagal tone. It also reduces the depression, anxiety, panic attacks, and enhances the confidence in the whole breathing process. This self-confidence that is enhanced is part of the empowerment process that occurs in yoga therapy. The increased muscle strength, improved balance, coordination, and flexibility add on to the feeling of being well and having a sense of being in control of one's body and also one's life. The proposed outcomes of the yoga training included a reduction in dyspnea and the dyspnea-related distress, decreased depression, anxiety, heart rate, and on the other hand, enhanced quality of life and physical performance. Health is all about a quality of life and being able to do what we want to do every moment of our life. Through this model, developed by Q&Co and colleagues, we can see how yoga has that amazing role to play in all breathing disorders. Often people get confused when you tell them to breathe slow and deep. They say, well, if I breathe slowly and deep, am I not getting less than if I breathe fast? We always think that more is better and the most is best. But in this case, it is not. And in this slide, you can see how my mentor, Professor Madan Mohan, who was director, Professor at JIPMA, director at SITER, and now emeritus professor at ABMC Medical College, he gave a beautiful understanding of how slow, deep breathing is economical and efficient. We can see that if the normal breathing volume is 500 ml, shallow 200 and deep breathing 1000, and we want a ventilation to be 6000. So someone who is doing normal breathing needs to breathe 12 times per minute. The shallow breather needs to breathe 30 times per minute, and the deep breather 6 times per minute. Now, one of the important concepts to understand is of dead space. Here in our respiratory passage, the first part, that is from the nose right down to about the 17th level of the tracheobronchial divisions, what happens is the air is being conducted, but there is no exchange. It is only after that, at the alveolar level and a few levels above it, that the actual respiration happens. So the first part is called the conducting zone, the second part, respiratory zone. So at any given time, in any breath, 150 ml of air is going to be in the conducting zone. This is the dead air space, because it is not doing its job of gaseous exchange. So if you now look at that diagram, you see that dead space is 150 milliliters of each breath, which means the dead space ventilation in normal breathing would be 1800, shallow would be 4500, and deep would be 900. This is like tax being deducted at source from your salary, but the same type of thing happened here. So what happens? Someone who's breathing normally 12 times per minute is getting 4200 milliliters. Someone breathing shallow after all of that work 30 times a minute, they are only getting 1500, whereas someone doing deep breathing at the rate of 6 per minute is getting 5100. Slow deep breathing is the key to health. And a lot of research by the most amazing Dr. Balayogi in Italy and his colleagues in Europe and Finland especially, they have shown that slow deep breathing at the rate of 6 per minute is the key to balancing the cardiac autonomic patterns, enhancing the endothelial function even in type 1 diabetes. So slow deep breathing is to be advocated. This is called Sukha Pranayama in our yogic terminology. And all the person needs to learn to do is breathe in, 2, 3, 4, 5, 6. Breathe out, 2, 3, 4, 5, 6. And this type of pattern, whenever you use that number 6, approximating 5 seconds for inhalation and 5 for exhalation, you are coming into tune with the number 6, a number of self-responsibility. And health ultimately is our own self-responsibility. There is a lot of research been done in respiratory conditions, and in the following slides, we can see how the pioneering work done by Dr. Nagarajna and Dr. Nagendra of SPSR, which was published in British Medical Journal in 1985 on bronchial asthma, was followed by a lot of work that has given us the scientific basis of using yoga as adjuvant therapy in COPD and bronchial asthma. There have been improvements shown with 4 weeks of yoga therapy and the different practices such as Dauti and Neti, which remove the excess mucus. A work by Satya Prabha in 2001 showed how this is very useful along with practices like Kapalabhati. It has been postulated that a non-specific bronchoprotective or broncho-relaxing effect is there with yoga, and exercise tolerance was improved even with patients having chronic, severe airways obstruction. Again, the work of Bernardi that I mentioned earlier has shown that slow yogic breathing maintains better blood oxygenation without increasing ventilation and reduces sympathetic activation and decreasing the chemoreflex sensitivity to hypoxia and hypercapnia. As we saw earlier, in people who have breathing disorders, the hypoxemia is there, and hypercapnia, there is more of carbon dioxide because they are not able to breathe out properly. And by doing slow deep breathing, if you can train the person and they can then learn to practice it on themselves, you are going to be helping correct it right down at this oxygen and carbon dioxide levels itself. Again, it has been shown that the telco, the FVC, PFR, all the indices of lung function, they are enhanced by yoga. This is not surprising for anyone in the field of yoga because in the yoga practices, especially pranayama, we are altering the normally unconscious autonomic activity of breathing by choice. The prefrontal cortex of choice is brought in, and we are starting to breathe as we choose, rather than as the respiratory center in the brainstem wants us to do. The moment we make choice, we take on that self-responsibility, that number 6 I was mentioning earlier, we start to change the way everything happens top down. There have been many studies, and even a study in young kids between the age of 7 and 16 showed how the exercise response positive asthmatics, that is those who would get asthmatic attack whenever they did exercise, after 3 months of bi-weekly program, that all of them could do exercise without getting an attack. Now imagine you are a small kid with asthma. You want to go out and play with your friends and you cannot because it induces an attack. Now if you just add yoga to it, that life-changing effects for that young child, not just that young child, for the whole family. This is where yoga transforms the individual, transforms the family, and ultimately the whole society. One of the very interesting aspects when it comes to the respiratory anatomy and physiology is the fact that we have more blood, that is the perfusion at the bottom of the lungs, and better ventilation at the top. So there is a dichotomy, ventilation, perfusion, imbalance. And so normally, as you can see in this slide, what happens is that the alveoli at the apex are under-perfused and over-ventilated. Alveoli at the base are under-ventilated and over-perfused. What does yoga say? Turn yourself upside down. What a normal person does standing up, we do standing upside down. And so what you can do is bring the head below the heart. What you have done now, you have turned the whole anatomy and physiology upside down. And automatically, more blood is now flowing to the apex, the top of the lung, and better oxygenation and ventilation to the bases. Now, of course, everyone cannot do practices like Sarvangasana, Shirasasana, but why think of only those practices? Anything where your head comes below the heart will be useful. For example, Balasana. Now, whenever a child is having difficulty breathing, he goes into this posture. The Virabhasana, the mountain pose commonly known as the down dog, Adho Mukha Shvana, and the Padahasta or the Uttanasana as known in some traditions. These are more simple practices where the head is below the heart, and the moment the head comes below the heart, automatically you change the ventilation, perfusion, ratio. Any place where your head can come down, including the bowing down to others. Such an important aspect, like the Japanese do where they make a full bow. Amazing practices in all religions, all spiritual traditions. Bowing down was part of humbling oneself, and by doing that, enhancing the healing process. Well, anatomically and physiologically also, something is happening. Another very amazing practice we can do is chanting. Because most respiratory disorders start in the sinuses. This is where the infection comes in and then triggers the attack. So what can you do for the sinuses? Well, you can chant. It is quite amazing that by chanting, we enhance the endogenous nitric oxide. And the nitric oxide in the nasal cavity is a sign of a healthy sinus. And a healthy sinus will prevent many of the lower respiratory problems from occurring. So what happens? Chanting creates sound vibrations, and this opens the tiny ducts, allowing the sinuses to drain properly, and they get ventilated by the humming. And what can we do? Now the yoga techniques. Nasarata Mukha Bhastrika, for example, a simple practice, as I mentioned earlier. What we do is we breathe through the nose and out the mouth. So, one of the practices. The Hakara Kriya, where we make the sound of ha, 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 ha. This type of sound is an explosive sound. It uses the diaphragm also. Kukriya Pranayama, the dog pan. You know, like the dogs do in summer? Well, amazing practice. Simhanada, the lion, which my father used to always love to do. When you take in a deep breath and then you go like that lion, you know, you can keep your eyes fierce and, you know, let everybody get scared of you and run off. You get your peace of mind, you know. That type of practice, excellent practice. Pulmonary pranayama is another good example where we use the humming sound of that bee. And those beautiful sounds of ventilating the sinuses, giving a sense of beautiful bliss that comes from the pulmonary within us. The Brahma Mudra is another practice. We are moving the head to the right, coming back to the moving the head to the left, coming back to the lifting the head up as we breathe in, coming back with the sound. And then breathing in and coming down, and coming up with the sound. become vowels. A, U, E, and then to end with a beautiful humming. In fact, vowel sounds are used in sound therapy for people who have sleep apnea. Gamamudra may be helping there also. And of course, the Pranava Pranayama using the Akara, A, Ukara, U, and Makara, that I will detail little later. One of the really amazing practices we can do is the Nada Bhavana Shuddhi Kriya. It includes Nada, which is sound or vibration, Bhavana Shuddhi, cleansing the attitude, and it is an active process, a Kriya. In this, we look at the anxiety and stresses that are stored in the abdomen, the middle chest, and the upper chest regions. The lower lung, diaphragmatic abdominal region is where the performance anxieties are, the butterflies in the stomach. You know, when that you feel as if the whole stomach is sinking, that type of anxiety. The mid-chest region is the relationship anxiety. Will they like me? Won't they like me? You know, those type of emotional issues. And this upper chest anxiety is from our position, our ego, which says, I am the director, I am the professor, I am the president of the company, that type of stuff. So we want to get rid of it. So we make the sounds of ha, 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 ho, 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 he, he. So through making these sounds, we are releasing this anxiety and stress, cleansing ourselves. We then go to the back of the head. This is the brainstem, the seat of survival instinct. In yoga, we call it abhinivesha, one of the kleshas, afflictions. And to cleanse this, we remind ourselves, me. And then, the most important thing is we start to work on our higher intellect. The prefrontal cortex, that place where the buddhi is, and that place which is capable of thinking of other people. And we use the sound di. So we have cleansed the anxieties. We have addressed the issue of our brainstem survival instinct. We have tried to open up our intellectual capacities, and then we realize that all of this is just a play of Maya. Nothing worth getting attached to, nothing worth holding on to. And we let it all out by going go, and we go down as far as possible. So join me for a round of this, okay? So let's start. Ha, 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 ha. Ho, 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 ho. He, me. Di. Go. And you feel much happier, much healthier. And you know what? You have been using your lungs. You have been exhaling actively. Normally, our inhalation is active, exhalation is passive. The moment you use these Nada Kriyas, you use these Nada Pranayamas, and you make these sounds, what you are doing is active expiration. Active expiration enhances the respiratory muscle strength, enhances the diaphragm, the abdominal strength. Amazing effects. Physically, physiologically, psychically, and of course, spiritually also. As discussed earlier, Neti, the nasal cleansing practice, is a very useful practice, and even modern science is understanding hypertonic saline. When you cleanse the nostrils, you can get rid of that excessive mucus that then is preventing the spread of infection into sinuses. Accumulation of mucus, stagnation of mucus, for that matter, stagnation of anything leads to disease. So that kapha, that mucus, when you cleanse it out with an neti, you are preventing sinus infections and thus preventing future asthmatic or bronchitic attacks. The Kunjal Kriya is a similar practice. In the Kunjal, what we do is that we drink the warm saline, and then we, of course, have to put our fingers to the back of the throat and we induce vomiting and we throw up. What this is doing is that working on a reflex, and this reflex works because, as you can see in this slide, the airway passage and the food passage, the trachea and the esophagus, are just separated by a thin layer. So you have the airway passage in the front and you have the food passage behind, and both are supplied by the same laryngeal nerves. So what happens is that when you stimulate in the food passage, the flowing up, what happens in the respiratory passage is a similar flowing up, and mucus that is plugging the respiratory passage can come up. A very effective practice that is used often in yoga therapy in India, and lot of research at Kaivalyadama in Lonavala, one of the oldest institutes, especially by Dr. Bole many years ago, published in Yoga Mimamsa, has shown the benefits of Dauti and Kunjal in people who have chronic respiratory issues. However, many people are afraid to use this because it may induce certain eating disorders, and if you have that fear, better not to use it. But in India, for getting rid of the excessive mucus, the kapha, what we do is the neti and this Dauti or Kunjal Kriya are used often. We can also do many other practices that are breath, body harmonizing practices. The breathing, bringing the mind and body together. This could include the Thala, Ardhakati Kriyas, the different type of jatis, simple movements we do. The Vyasa Pranayama, which is the tiger breathing, sometimes people call it the cat cow. The Pavanamukta series for the lower abdomen, and again the Bhujangiri Mudra, where we breathe in and then we hiss out like a snake. Again that active expiration, helping the person train their passageways to release effectively. The Surya Namaskar is another useful practice depending on the person's physical capabilities. Postures from the standing, the Ardhakati Chakra, the Vedavasana. Postures from the sitting, the twist, like the Ardha Matsendra, the Vakra, or the Ushtrasana. Again, what I am depicting are the final postures. But depending on the person's physical capabilities, modifications can be made. Different forms may have to be used. Because what is more important is a perfect effort. It is the effort that counts, not the perfection in the posture. Perfect effort, not really perfect posture. But it is good to keep in the mind's eye what that perfect posture should look like. Because the mirror neurons in our brain, they will start to have that feeling of what that posture should look like, and that will have its own effects. Because the rupa, the form, it can be educed and induced by our contemplation. As I said earlier, the Chatushpalasana in the Vyagra, the tiger breathing, where as you breathe in, you raise the head and lower the back, and as you breathe out, you lower the head and raise the back. That is a very, very effective practice because again, enhances the whole lung function. Postures done from lying down include the Balasana, Matsyasana, Bhujangasana, and the Pavanamukta series, again performed depending on the physical capabilities of the individual. Pranayamas that are normally used could include the bellows breathing, the Vastrika, or the right nostril in, left nostril out, Surya Vedana, the Pranava, the Anunasika, which is a nasal blasting where there is an inhalation followed by multiple exhalations, which again helps expel the mucus and clear the passageways. Kukriya, as I showed you earlier, the dog pan, and the Brahmari with the bass sound, the high-pitched bass sound that ventilates the sinuses and produces a sense of calm. Relaxation practices could include the Makalasana, which is the throne, the Shavasana, and the Spanda Nishpanda, where you contract and you let go all the body parts, and the Kaya Kriya, which is specific to the Gita tradition, where with the breath we are doing lower limb movements, upper limb movements, and then the head and neck turning and bringing it all together. Finally, with the low, mid and upper parts of the breathing. The Kaya Kriya is another excellent relaxer. A practice that is specific to the Dr.Ananda tradition works on linking the low, mid and upper section breathing along with the body movements. In this, we do the movement of the lower limb with low chest breathing, upper limb with the mid chest, and then the head and neck with the upper chest breathing, and then we yoke it all together. The low, mid and high with the movement of the lower limb, middle and the head and neck, and then the lower limb, the hands, and then the head. A sequence that is done in the Kaya. At this point, I want to introduce one of the very specific set of practices in the Dr.Ananda tradition that is focused on respiratory health. This is called the Hathinas. The Hathinas are the forcing techniques to enhance lung function. They are asanas, kriyas and mudras to mindfully utilize all parts of the lungs by consciously forcing air into all of the bronchopulmonary segments. It is based on the principle Yato Mana Tato Prana, where the mind goes, there the prana, the energy comes. When we look at the structure of the tracheobronchial tree, what we find is that we have the low, mid and upper lobes on the right side, the right lung, and on the left side we have the lower and upper lobes. But if you go down into the actual tree, you will see that there is a lingular area that functions just like the middle lobe of the right side. So when we talk about low chest breathing, mid chest and upper chest, functionally we are not wrong, though anatomically on the left side we don't have a middle lobe. And again, if you look at the lungs in another way, we have 10 bronchopulmonary segments. These are individual segments in the lung, and there are 10 on the right, 10 on the left. So both lungs have equal number of bronchopulmonary segments, having respiratory passageways, blood vessels, lymphatics, and nerve supplies. In Vivara Pranayama, we are trying to breathe and focus our mind into these areas. By focusing the mind, focusing the energy flow. And for this, we start to use our hands, the sparsha mudras. Placing our hands on the lower part of the chest, we can let our mind get anchored there. The front, the side, and the back, or the mid lungs, front, side, back, or the upper lungs, front, side, and back. What we do by placing the hands, these are called sparsha mudras, is that we are using the hand to help the mind focus there. And when the mind focuses there, the energy flows there. So 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 areas are being focused on. Very similar to the bronchopulmonary segment concept of modern medicine. Most people are breathing less than 10% of the capacity. The moment the mind comes into it, the moment you start working on it, you can enhance the capacity. So someone who was struggling to breathe because they were already at a lower level of capacity, the moment you bring this mindful practice into their life, you change the whole life. You transform the physical, mental and emotional well-being amazingly. So the practices for the low chest are the 3 versions of the camel, the ushtra, and then the first of the shashaha, where the knees are touching the elbows and you breathe in this position. For the madhyam pranayama, the 3 matsyasanas, where the 2 have the legs stretched out, that are very useful if the person also has a cardiac condition, and then the cross-legged classical version, and then the shashahasana 2 with the elbows extended. The Mahamudra, where we breathe out and then we pump using the extended hands or the clasped hands, versions 1 and 2 of the Mahamudra. When we do this, we expel very efficiently the stale air that is stuck in us. When we talk about people who have bronchial asthma, most of the time there's air trapped inside. This Mahamudra practice 1 and 2 helps to release the air that is trapped and thus reduce the hyperinflation and then helps them to breathe better. The Balasana and the Shashaha are the other practices in this. The Chatushpada, the four-footed posture, is one of the healthiest things we can do by coming down on all fours. The Vyagra Pranayama, the tiger breathing, and then in the Chiri, Kriya and Sharaba, stretching the right leg out or the left leg out, we are working on that side of the lung, enhancing low, mid and upper parts to function together effectively. All of this is brought together when we perform the Pranava Pranayama. In the Pranava Pranayama, we use the different mudras. For the Adama Pranayama, we use the Chin Mudra. For the Madhyama, the Chin Maya. For the Adhyama, the Adi Mudra. And then we bring it together for the Brahma Mudra or the Mahadyoga Mudra to perform the fourth part. Each of these we do with the sound. So the mudras are placed down on the inner aspect of the thighs and focusing on the lower lung, we take in a deep breath and then we breathe out with the sound. Similarly for the mid chest, the Chin Maya Mudra, we breathe into the mid chest and we breathe out with the sound. For the upper chest, the Adi Mudra, and breathing out with the sound. And then we bring it all together, the Maha-Yoga Mudra, the grand unification breath, where we perform the Brahma Mudra or Maha-Yoga Mudra at the navel, and we perform a deep inhalation, low, mid and high, and then this practice should be performed 3 times each. So 3 times the Akara A, 3 times the Ukara U, 3 times the Makara and then 3 times the Omkara A-U. Pranava is one of the amazing practices. Tasya Vachakaha Pranavaha, Patanjali tells us. It is a practice where we are evoking the universal Nada, the universal Shabda, that Pranava, that is Ishvara itself, harmonizing us as an individual with the universe, helping us to heal ourselves by being the greater being, the bigger picture that we must be. As a yoga therapist, we are not an island anymore. We need to work with other systems. The systems could be those of modern medicine or the traditional systems such as the Ayush systems in India, those systems that now are part of the complementary and alternative medicine, or traditional integrative medicine as has been suggested by the World Health Organization. Practices can be done in collaboration with chiropractic, osteopathy, naturopathy. But what is important is to remember that dietary advice, attitude changes, and most importantly, relaxation must be an important part of our yoga therapy protocols for individuals with breathing disorders. It is important to remember that if we want to be healthy, we have to make the choices and we have to put our thoughts into our words and our words into our actions. It is only if we exercise regularly, eat healthy, reduce stress by making those conscious choices not to let anything stress us, and drink adequate amount of water. Hydration is vital for the health of every cell in our body. If we keep all of this in mind, we can definitely bring to manifestation our wish for a healthy and happy life. My father, Swami Geetananda, so often used to remind us, health and happiness are your birthright. Do not forsake your golden culture for the plastic playthings of the modern world. Learn and live yoga, for then you will know true health and happiness. That is the message we, as yoga therapists, must take to the world. We need to be healthy and happy ourselves and enable others to be as healthy and as happy as they can be. That is the way we can grow, because each of us is a potential diamond. And if you remember that a diamond is just a piece of charcoal that handles stress exceptionally well. If you remember that message, we can be that wonderful diamond we are to be. And that is why, for me, the highest attitude is one of gratitude. I take this opportunity to thank Anne-Marie, the Yoga Mate team, and my dear yoga therapy family worldwide for this wonderful opportunity to share some of my thoughts with all of you. I wish you all a very happy and fulfilling Global Yoga Therapy Day on August 14th. Live yoga, love yoga, and share yoga. Namaste.
योगेन चित्तस्य
पदेन वाचां मलं शरीरस्य च वैद्यकेन योपाकरोत्तं प्रवरं मुनीनां पतञ्जलिं प्राञ्जलिरानतोऽस्मि।
Click on the directory link to work with Dr. Ananda or another qualified yoga therapist or specialist near you. You can search by health concern, location, or by a therapist offering online sessions. Join us on August 14th to experience the difference of yoga therapy for yourself. You can find a yoga therapist participating near you by searching the free app Yoga for Better Health or visiting globalyogatherapyday.com. Make sure to also follow us on Facebook, where yoga therapists across 14 time zones will be teaching live sessions on our Facebook page, Global Yoga Therapy Day. Thank you to our platinum sponsor, the International Association of Yoga Therapists.